Well, good morning, everyone. This is Allie Holtenstroop. I am the CCT lead for TennCare. I will be conducting your trainings today and tomorrow. Thank you so much to everyone for joining. And it looks like we have several more individuals who've just joined. So again, my name is Allie Holtenstroop, and I am the CCT lead for TennCare. We're going to be breaking up the training into 2 days. So today we're going to be focusing on just getting a quick orientation and navigation view of using the CCT. We're then going to be jumping into how you can view your member panel and members. So just a few housekeeping items before we get started. This session is being recorded. We will have the recordings available for you to view on our CCT Learning and Training webpage by early next week. I'll show you that webpage before we end for the day so you know what it looks like. During the training sessions, we're also going to be using a specific training environment. So all of the data is de-identified, it is not up to date. Some of the features and functionality might look slightly different once you're in the tool because again, this is a specific training environment. But it should replicate pretty well what you'll see when you're in the tool. All participants are muted for the training session. We will be using that chat feature for questions and technical support. So please feel free to put your questions or if you're having any technical issues, put that into the chat. And if you can put it to everyone, that would be helpful. We have Dylan Tracus here helping to make sure I stay on track of all the questions and helping with those technical support questions. With your questions, we just ask that you leave out any PII or PHI from your questions. All right, so again, today's agenda, we're going to be going over orienting how to navigate the CCT. So we'll be starting with what you'll see when you log in, which is the dashboard and a set of menus. Then we'll be diving in and focusing specifically on how to find your member panel and segmenting out your member panel according to things like demographics, their THL status, the health plan they're with, etc. We'll also be then diving in to see how you can look at individual member level data. So an individual care plan, their profile, health tracker, and care note summary. All right, so some of you may have already seen this if you've been able to log in to the tool. Once a care coordinator or a practice administrator logs into the tool, their landing page is going to be this care dashboard. So just to go over this orientation a bit, we have a lot going on here, so we're going to break it down. So right here is the main dashboard, and we have some widgets giving us some information and a couple bigger graphs to give us a bit more information. So first, if we're going to start over here on the left-hand side, our first widget is this total member section. So here, this is going to break out how many members you have enrolled. And then we have a specific bucket for new members. New members are going to be called out if they were added within the last week's attribution file. So we receive those attribution files from the MCOs by Friday of every week. So you would see that update once you come into the tool on Monday. You can click into the members tab to get more information, and we will go over that once we jump into the tool. But again, just a quick overview of how many members you have enrolled and any new members who have been attributed to you from the previous week. Our next little widget here is the quality measures widget. And this is just giving you a quick shot of how many members you have that have met their associated quality measures or their gaps in cares, and then how many have not yet met those measures. Again, just a quick overview, give you a snapshot. This, again, you can click into to get more detail, and we will be going over that tomorrow, actually. We do have then a widget over here for MTM, and that is our medication therapy management program. So this widget would just indicate how many of your members may be eligible for that program, and then how many may have had a comprehensive medication review that are completed or pending with the MTM program specifically. Finally, down here, this last row of widgets, we have our high risk breakout. So this is based on the CDPS plus RX. So how a member is categorized, whether they're high or critical risk. This is going to break out all your members that fall into that high critical risk bucket. We then have our ADT snapshot widget. This would indicate to you how many members have been admitted into the hospital or visited the ER, and then how many have been discharged. The view from this widget is a month's view, so it would be any admissions, ER visits, or discharge within the past 30 days. This section we'll dive into a bit more tomorrow. And then finally, we have our MCO scorecard, which is one of the report features available to see how the performance of your practice is going for those MCOs. And we will go over that a bit more tomorrow. All right, so a bit more orientation over here to the left-hand side. We have some additional menus. So it starts with our care management, and we can think of this more at the macro level. So we would be able to search for our entire member panel under this using the member search feature. There's also information for contacts and outreach if you're doing some contact and outreach with your members. There's general notes. You could look up general notes for members, any interventions. Assigning members will be an important one for those practice administrators specifically. This is a feature only available for practice administrators, and it will allow you to assign members to specific care coordinators. And we will go over the steps of that a little bit later. We also have our admissions and discharge tab. Again, we'll focus on that tomorrow. And then we have our forms, resources, and education tab. So this will have some helpful handouts, things like CPT coding guides, which will help to understand what codes help close those gaps in care. We then have our member management, which would be going more into the micro level, so looking at detail at a specific individual level. And we will go over that a bit later today. And then we have our report section, which we'll be focusing on tomorrow. Again, just quick navigation. A few other navigation items are up here. We have a bell, which would indicate any alerts. So if you have a member who's been to the ER, you would have an alert here, which would indicate that they, you would need to check this, and it would alert you to who's been admitted. And we can go over that tomorrow when we're focusing on the ADT portion. We also then have this little home icon here, which will bring you to the home section. The other one I want you to know, which would bring you back to the dashboard, is this abstract grid view. So anywhere you've kind of taken yourself through searches, this will bring you back to this home dashboard. Okay, so member search, this is where we're going to be spending more of our time today, is getting that overview of how you get that member panel level information and then diving down into individual level information. So just a quick orientation to this page before we jump into the tool. When we click on our member search over here on our left-hand menu, we're going to be brought to the specific member search page. The search page will automatically populate your entire member panel, and it's based on those members who are actively enrolled in TennCare and attributed to you. We do have the ability to do some individual searches if you're looking for a specific segment of your population or even a specific individual. So we have all of these search items here to filter by. And then we have what the view will look like once the search has come back with the specified filters. So from here, I'm going to exit out of this, and we're going to actually jump into the tool so you can start seeing what this will look like in action. I'm logging in as a practice administrator. And again, when I log in as a practice administrator or a care coordinator, we're coming to that same landing page of the dashboard. All those items that we just kind of went over quickly to orient us. We're going to focus again over here on the left-hand menu and come down to our member search. We can see here it's loading data, and again, it's loading your entire attributed member panel. So from here, we can see that this practice has quite a bit of members associated with it. So this may be a bit overwhelming to work with, which is why we have all of these filters to kind of narrow it down if we're looking for a specific segment of our member population. So the first item I want to go over is we do have the ability to search for a member by specific name. If you have a specific individual you're looking for, you can search for them by several means. So you can enter their full last name, comma, full first name. We can look up their full last name, comma, partial first name. Similarly, we can do a partial last name, comma, full first name, or you can search by their last name or first name only. You do have the ability to also search by a specific birth date, a specific gender. If you know the member's MCO ID, you can search by that, or you can search by their social security number. We can also break this down to be a bit more smaller population specific. So chronic conditions, perhaps you're looking for all your members with asthma, for example. You'd be able to search that way. We also can search by health plan. So if you're looking for members that are with a specific MCO, you can search by that specific MCO. The beneficiary status is related to their TennCare status. So it's always going to auto-populate to those actively enrolled in TennCare. But you can search for termed or deceased. They do not stay in the tool more than a couple of weeks, just to give you that heads up. The care coordinator, if your practice is assigning members to a specific care coordinator, you can search by members by that specific care coordinator. So this can be most helpful for care coordinators wanting to come in and just pull the members that are assigned to them and focus on outreach to those members or follow-up, what have you, that are assigned to them. So again, this would only work for practice administrators who are going into the tool and assigning. Looks like my audio has lost. Dylan, can you hear me now?
You're coming back in. It's still a little choppy, but we lost you maybe about 30 seconds ago.
Oh, okay. Is this better now?
Better. It sounded like connection issues more than like your microphone or anything. Your voice was coming through clear, but then it sounded like the connection got disrupted a little bit.
Okay. All right. How about this? Is this better?
We can hear you as you're speaking. We can hear you. It's a little choppy. If you want to continue, I can just try to keep you informed as to how you're sounding.
Okay. Let me try one other thing.
Right now.
All right. Is that any better?
That's a little better. Mm-hmm.
Okay. Great. I'll continue this way. Just let me know if it drops again.
Okay.
All right. Sorry about that. Okay. So care coordinator, we can search by specifically assigned care coordinators. So This can be very helpful for care coordinators to come in and find their members assigned to them specifically so they can focus in on that outreach, follow up with their member panel. It's definitely only going to work if the practice administrator is going in to manually assign those members to a specific care coordinator. Again, we will go over that a little bit later today on how practice administrators can do that. The next filter we have is by program. So if you're wanting to focus on just your PCMH members, and then you maybe want to focus on some of your THL members. If you have a number of members that are within the THL program, which is the Tennessee HealthLink program, then you can focus on those members. The program status would be, yeah?
It's like for like 2 seconds it'll be kind of bad and then you'll come right back. Would you maybe want to try calling in on your cell phone?
I'm actually on my cell phone, so and I have full bar, so I'm not sure what's happening.
Okay, well, right now you sound great.
Okay.
Just in that last little bit, you cut out a little bit. So, if anybody else is having trouble hearing Allie, feel free to let us know in the chat. Sorry for the disruption, but Allie, I guess if you're on your phone, then please continue. And if we ever lose you fully again, how about that? If we ever lose you fully again, I'll let you know. Okay, so it sounds like everybody in Memphis is hearing you loud and clear. So that's great. Maybe it's on my end. I apologize.
No worries. Thanks for letting me know. All right, just let me know again if it drops.
Will do.
Okay, so program status will be associated with the specific program you selected over here. So again, if you're focusing in on just PCMH members, you know, they're gonna all be active. You're either in PCMH or you're not in PCMH program. If you're wanting to focus on maybe members that are in the THL program concurrently with your program, you can select the THL program, and then we have THL programs a bit different. They have numerous program statuses. So if you're wanting to see those members who are actively in the program receiving support, you can look up those that are active. You can also see any who've been attributed to the program, but maybe not yet enrolled in the program, or those who've been discharged, who've become inactive and are no longer receiving behavioral health treatment, they're a new member, or if they've been terminated. All right. So for this, I'm going to just keep it all of our general members for our search. Now you can also search by a specific assigned provider within your organization. So we would come to this little magnifying glass for provider search, and you can type in their last name or their first name, credentials, the group name, and then you would select the individual that you're looking for, or individuals. So perhaps you're a care coordinator and you only work with a couple of the providers, so you just want to see those members. You would go ahead and click on those specific providers you're interested in, and then you would click the select checkbox, and it would populate here with those specific individuals that you wanted to focus in on. Since we're in a training environment, we don't have people necessarily assigned to anyone, so I'm going to just come back in here and unselect those so we get as many members back as possible. Okay. And then the last item we have here in our search filter is the risk. So for this, you can see I have no options here, and that's because we haven't selected any programs yet. So for here, we're going to come back up here. Let's focus on our PCMH members, and we want to see all of our high critical members. Now we do also have advanced member search over here with this little cog. So I'm going to click on advanced member search. And here we have some additional filters that we can set that may be helpful depending on practice's workflow. So you can select a filter by a specific age range. If maybe you're trying to work with population, pediatric populations needing one of their shots or something. We can also search by race, ethnicity. We can search by county or zip code. I know both of these have been very popular with certain practices as they assign out members by county or zip code. So I'm going to focus in on county for this one. Now with this, you would go ahead, we would select, Tennessee. We have New Jersey in here. Again, it's that training environment. And then you would select your specific county. And we would click on Save and Use. Oh, it's not wanting to do either. Oh, that's right. I forgot to title this. So this will be our county search. So we have the ability to just save it and use in the future, or we can save and select, indicating that we want to use the search currently. And now we see that it's come back here, that it's going to add that county filter. Now we'll come over here, then we have all our filters set, and click on that magnifying glass. And of course, I've narrowed it down a little bit too much for our training environment. So I'm going to come back in here and take out that county report so that we can focus in. Most of the training environment has changed everyone to be in New Jersey. So we will change that up and search again. And now we can see that it's pulled up definitely far less members than we had previously to focus in on all those high critical members within the PCMH program. So from here, we can export this specific breakout to see, more in detail, do some data analysis, assigning out to care coordinators, whatever the workflow is, we do have the ability to export out to Excel. So I'm going to click this and let it load. While we're letting it load, I do want to just give a general orientation here to what we can do within the tool in the member search once we have the panel that we're looking for. So first we have this little hand icon, and that indicates if we're wanting to select the member to see more individual level detail. We have our little care gaps icon here if you're wanting to see the member's specific care gaps. And then we have this little icon that is, again, just indicating that this member is actively enrolled with TennCare. We then have the member's name, date of birth, their age and gender, which health plan they're with, their MCO member ID, their social security number, their primary and secondary care coordinator. Now, again, these will only populate once they've had a care coordinator assigned to them by that practice administrator. Scrolling over to the left, we have also the assigned provider, the phone number for the member, their risk status and their risk score, any chronic conditions, and this will only list the first one within this box, and we can see there's the triple dots next to it indicating there's more to read. So if we click on that, it will list out each of the chronic conditions this member is being treated for. And then finally, we have THL status when applicable. So if they are actively in the THL program, it's going to be indicated here, or attributed not enrolled, all of those program statuses that we kind of reviewed a bit earlier. Now, when we open our export, Let me just pull this Excel over to this screen. You can do a bit more data manipulation here. So we have some of the same filters here. We can set a filter here and we can manipulate the data as needed. But we have that, again, beneficiary status will always be that they're actively enrolled in TennCare. Their member name, full name, date of birth, age, gender. We also have race and ethnicity. And then we have their full address, including county and zip code, and phone number. So again, this can be helpful when trying to assign out to care coordinators or doing follow-up. We also have the health plan that they're with, the MCO member ID, their social security number, and again, if the practice is assigning to care coordinators, we would have primary. If they're using secondary, a secondary care coordinator would be listed as well. We have their assigned provider, their risk level and risk score, any chronic conditions, and in this field, it will just list all of them out. We have their THL status, if applicable. And then we did not use any of these specific search filters, but they currently do populate even if you have not used them. That is something we are working to have changed, but at this point you would expect to see those. So again, putting some filters on these columns, you would go ahead and be able to do some data manipulation and focus in on the member population that you're interested in, assign out to care coordinators, you know, whatever your practice workflow would be. All right, I'm going to pause here. I know we've gone over a lot. Are there any questions on using the member search feature or the export from the member search? All right, so we're going to come back to our member search screen. And we're going to start looking at individual level data. So again, just as a reminder, this little hand icon is how we would select a member in question that we're wanting to find out more information on. So let's say, for example, we'd like to find out a little bit more data on this specific individual. We will click on the little hand icon next to their name. And it's going to direct us to what this platform calls the care plan for this specific individual. And that's a great question, Allison. So yes, if you're only contracted with one MCO, you'd only be able to see your members with that MCO. Thanks, Dylan. All right, so this care plan, here's a little orientation. So at the top, we have just an icon that's going to indicate their gender, and this is not something that is changeable, and this is coming from the data that we have with the members' assignment in TennCare. So once they become a TennCare member, it will either show female or male. We also have their full name. We have the individual's date of birth and their age, indicating their language preference as English. If it's Spanish, it would indicate Spanish. We have an indication on whether they have allergies or not. And here we have their risk level. So this member is high critical. We also have their contact information. So we have their full address here, the member's phone number. If there's an email address, sometimes we get that from TennCare, many times we do not. You could manually put this in there, and I can show you how to do that a little bit later. We also see that this member is assigned to a specific THL program and what that phone number is. All right, now scrolling down a bit, we have a lot of detail here at the care plan level. So we can see all of the programs the members enrolled in, when they became effective and when they were enrolled on, and their current status. So this member is actively in the MTM program, the Medication Therapy Management Program. They are also in the THL program and a PCMH program. So this can be really helpful with care coordination to determine which programs they're enrolled in. We also have primary diagnoses for the individual. Now this box is based on the highest paid out claim. So for this individual, it is showing that most of their claims have been paid out for ADHD, which is listed out here. We do have the ability to click this little eye icon to view any further information. And it's just showing that we have those 2 primary diagnoses, which is the same thing, when they were added on. Now these will auto-populate again based on the highest paid out claim. We also have chronic conditions. So individuals you may see a difference here with the primary diagnosis and the chronic conditions. You can see here this individual has also a diagnosis of anemia and learning disabilities. You can click on that eye icon again to get any further information listed. Chronic conditions will only list out the top 3. There are some individuals who will have more than that, so you'd have to click on that eye icon to see beyond the 3 chronic conditions. We do have a health tracker, which includes weight, blood pressure, blood glucose, things like that. These are not populated automatically because we do not have any clinical information coming into TennCare for that to be populated. So this would be something you can use. It's an option. It's not mandatory to enter information in here. The CCT is not the source of truth. So if you're, only using your EMR to track weight and blood pressure, there's no need. You do not have to enter that here, but it is available should you want to have that available in the CCT as well. You would just have to manually enter it. All right, the next section is the evidence-based gaps in care. So this will list out any gaps in care associated with a specific member. So this individual does not have any specifically related to them, but we will go over this a bit more tomorrow. We also have the medication list. So this will list based on claims from pharmacy claims. We have the ability to see a few here, but again, we have that eye icon and we can see potentially additional medications beyond what's available within the little snapshot screen. So we can see here that we're searching active medications, and this individual is on several active medications that are listed out here, and gives you the information on their dosage, how they're taking it, the frequency, and who prescribed it. You can also, if you're interested, see any inactive medications if that's something you're interested in. From here, if you're trying to update the medications that they're actively on, maybe you know that they have come in and they're no longer going to be on amoxicillin, you can use this little pencil icon to edit. It's going to bring up a screen that will walk you through, and you can change the status to inactive, and it will ask for a reason. So you go ahead and put a reason in, and then the source. So perhaps the provider indicated to you that they are no longer on this, or the member themselves. So you would just update the source and then click the checkbox to save. You can see it's now italicized here and changed to inactive. So once you update the screen, it will then shift from this active page to the inactive. And we can see it's now listed here. Before you exit out, you want to make sure you click that floppy disk to save what you've just changed. All right. So now you will see the change here, listing out the medications, and the one we just took off is no longer there. All right, our next box is the prospective risk score. This again is based on that CDPS plus RX algorithm that will populate for the member based on claims and diagnoses. And so it will show you here what their prospective risk score is. Again, we know this member is a high critical member, so it's not surprising to see a high risk score here. Next, we have our problems, goals, barriers, and interventions. This is another box that is not required to use, but can be very helpful for the care coordination process. It allows you to see any goals that you're working on, maybe to bring down barriers or specific interventions you're working on, and track them with goal due dates, updating them with notes, and it will allow all members that are working with this member to see those same notes and goals. So we have a few tests here. If we want to see more, again, we're going to click that eye icon. All right, and let's just look at this one right here. So we have goals to close some care gaps and get recommended immunizations. And they've listed barriers out as access to health care, child care, environmental, and lack of a support system. And there's some interventions that go along with that, such as updating the care plan, closing care gaps, helping to arrange appointments and transportation to those appointments. And scheduled interventions, dates were set with goal dates, and then there's been some notes added. Let's look at those notes. So again, just quick note, close the care gaps for the members. We can delete these if they're no longer being worked on, or maybe you had to just create a new one once you got more information. You can also edit, which would be using this little pencil icon. So here you could, again, add any additional goals, any additional barriers, or additional interventions that you're going to be using to help address those barriers. And we can see that the goal was started on October 8th, so we will not be able to change this since we're just updating the goal basically. But you can change the goal due date if you've found some more information, or maybe it's taking a bit longer to address those barriers. You can schedule interventions so that you get notifications to remind you. So here we go. So let's say we want to have a scheduled intervention on the 30th of this month. We go ahead and update that date. And we're going to keep it in progress because this is a goal that is continuing to be worked on. And we will click Save. Oh, we got to update the goal date. My apologies. Okay, so I want goal and scheduled intervention to be more in alignment. There we go. And so we're going to see that change now up here in our little snapshot. So again, this is not required to use, but it is something that may be beneficial to your practice. Another box that could be very helpful for care coordination purposes will be this care team box. So this is going to list all of the care team members working with the member. So that's within your practice as well as within the MTM or THL programs. So it's only going to list the top 3, but we do have this eye icon to be able to see more individuals. So this individual, again, is with a PCMH program, a THL program, and the MTM program. So we can see that they have a PharmD assigned to them with their phone number and name. They have a few care coordinators. So we have each of those care coordinators listed out with their phone number and which practice they're with. And we also have their provider, phone number, and practice with the PCMH, as well as their provider, the program that they're receiving THL services from, the phone number, and again, just the indicator again that with the THL program, you are assigned to the practice rather than an individual provider. So this is very helpful if you're trying to do some care coordination and reach out to other team members about a member. You can add an additional care team member here with this plus icon. It will walk you through the steps of selecting their role, their name, phone number, the type of provider and specialty, and any reason or notes that you want to add there. After you add that, you just want to save with this floppy disk icon. And once you do that, it will update here on the care team box. All right, so this last box on the care plan has a lot of helpful information. It's called the summary status. So we have the first little tab showing the diagnoses groups associated with this member. We do have a column for cost here, but we do not show costs within the care coordination tool itself. That will always be a 0. We have a claims history tab, which can be helpful to see the different claims and services that a member is receiving. So we have the ability to dig down a little bit deeper into some of these claims by clicking this little plus icon. So we can see this member had service at Community Mental Health, Helen Ross McNabb Center for Attention Deficit Hyperactivity Disorder. And it will show here a little bit more detail. So there was some care coordination, risk adjustment, and then medical home program and planning and intervention planning. So definitely it can be very helpful for care coordination purposes. Next tab is our prescription tab. Allison, that's a great point. So let me come back here to the claims history. So this will show all the claims associated with a member. So if your member is coming to your PCMH program, you will be able to see those claims. If they're also participating in a THL outside of your program, let's just use Helen Ross McNabb Center, for example, if they're getting services there, you'd be able to see the claims for that program as well. So it can really help if you have those members who are both in your PCMH program and maybe a separate THL program. Sure. Okay. So the prescription history is definitely helpful if you're wanting to see the member's history of medications that have been assigned to them and paid out, of course. So we have the medication name, when they were dispensed, when they were paid on, the strength, the quantity, the prescriber's ID and their last name. It does have columns for copay and paid, but again, we don't have any costs coming in to populate that area, so you would not have that information. All right, and the last tab can be very helpful as well. It's seeing the movement of a member. And so if they have changed MCOs, for example, maybe they went from United to Blue, you'd be able to see when that change happened. If they're in a THL program and a PCMH program, you'd be able to see that and the dates associated with that. So for example, this member had been with THL and then became inactive, but joined again later in that same year. And so again, you as a PCMH would be able to see members that are also within the THL. As long as they're your members, you'll be able to see them. So it can help with that care coordination purpose. And again, can be helpful if they're moving around from MCO to another MCO. All right, so again, this has been a lot of information just right here on the care plan page. Are there any questions? right, so the final thing I do want to go over on this care plan page, we do have a couple of other little icons up here. This is timing, how long that you have been within the care plan, which may be helpful for just tracking how long you're doing care coordination services for a member. We also have the ability to print. So if you're wanting to print the care plan, maybe to do a case review with another team member, or maybe you're wanting to print some selected items from the care plan for the member themselves, you do have the ability to do that. So you have the option to either select all and just have everything printed for the member. I would say for members who are on a lot of medications or receive a lot of services, those claim statuses and pharmacy sections can be quite lengthy. So if you're really just wanting to focus on a few areas, you'll want to hand select which areas you're wanting to focus on. Just for the sake of showing you what this looks like, though, I'm going to have everything selected so that I can show you what this PDF will look like. There we go. All right. So we can see that this is 15 pages for this member, since they do have a lot of claims and medications. But we do have, it's a nice looking care plan. So we have their personal details, you know, their last name, first name, date of birth, home phone number, you know, basic information such as that. We also have the programs they're enrolled in and the effective dates and whether they're active or inactive. We have a clinical profile for the individual showing their primary diagnoses and chronic conditions. If any information's been listed in the health tracker, so if you've input any weight or blood pressure, it would populate here. We have any of their gaps in care that may be associated with them. We have their current medication list. We have their prospective risk score. If your practice decides to use problems, goals, barriers, and interventions, they will all be listed out here as well. We have the diagnoses groups that the member has been treated for and a history of their claims. And this one's pretty lengthy, so I'll scroll through quickly. Again, you can see if you're not really wanting the claims history printed on this, you might want to make sure that's not selected. All right, then we have their medication history section. And then we have their eligibility section, which again indicates which programs they're in, any movement between programs or MCOs, and those dates. Time spent for interventions or care planning purposes on the member. And then the care team assigned to this member. So again, not just from your practice, but any other practice they're seeing for services within the 10 care program. So that again is going to be not just the PCMHs, but THLs and MTM programs. Any questions on the care plan?
Hey, Allie, a couple of questions have come in. Nothing about the care plan, I don't think, but Allison writes, and I just responded to Allison in the chat as well. But it's maybe a good question for everybody to hear you discuss, Allie. The question is, do you find that most 10 care PCMH practices use the CCT for documentation purposes, or are they really documenting using their own EMRs, EHRs for documentation?
Yeah, that's a great question. So you definitely want to keep documenting in your EMR. That is the source of truth. So some practices will also document critical items within the care coordination tool for care coordination purposes. So other members of the team working with that individual have that easy access. But again, the CCT is not a source of truth. So what is put into this record is not going to go back to your EMR system, for example. So your EMR does need to remain that source of truth.
Awesome.
Yeah, great question.
Yeah, and then Beth asks, and I know you had mentioned, taking a look at the training or at the Learning Library and Training website. So not to push you there right now necessarily, but Beth indicates, that obviously there's been a lot of information we've covered today, as they have questions while getting into the tool and really starting to use it and try it out. Where can that go? Do they contact you? How can they get support?
Yeah, that's a great question. So it's going to be great to go to the CCT Learning and Training page, which I will definitely go over before we end for the day. With questions that are more specific, you can reach out to tencare.cct@tn.gov, and we can help troubleshoot those questions for you. Oh, you're welcome. And I do see Allison's question on ADT. Yes, we'll be going over ADT and quality measures tomorrow. Oh, okay. We will have this recorded and up on the website, so you'll be able to review that once it's posted early next week. Yeah, you're welcome. Right, so there's some other sections available when looking at member level detail. So we have care note summary, and this would give kind of an overview of notes that you've entered for an individual. So those interventions that we had kind of seen on that last care plan page will be listed here again. We also have any contacts or outreach. So if you're following up with a member, putting a note in here will populate right here, and general notes as well. So general notes, we have this little add general notes button up here, and you can add a note here just to maybe you wanting to remind yourself to give them a call, or just indicating that you attempted to call them and weren't able to reach them, what have you. You have the ability to do that here and save it. Right. I know we're starting to run a little bit short on time for some of the other items we want to go over. Episodes is going to be all ADT focused. So we will come back to this tomorrow, but I can show you this is specifically to see any ADT information at the specific individual level. So if you're wanting to just see for a specific member, if they've been to the ER or how many times they've been to the ER in a specific time period, you'd be able to do that search here. So the health tracker goes back to the one area of the care plan that I mentioned would have to be input manually. So BMI, blood pressure, blood glucose, that is not any data that we are receiving at TennCare to be able to populate into the tool. So if you're wanting to have that added here, you would have to manually add it within the appropriate section. Again, this is not the source of truth. This is not something you need to enter. If you're wanting to enter it here, you have the ability, and that would show for anyone who is taking care of this member, so that the whole care team's on the same page. We also have a little medical care tab. And this can be really great for practices that are working with children, because we do get our immunization feed from tennis. So you won't be able to make any changes to then go back into tennis. So you still have to enter into tennis, following the same protocol you would now. But this is a good way to see this immunization section. Will pull in any tennis data to give the provider an updated view on when their last immunization was provided, if they had a specific immunization provided, or maybe the immunization has not been provided, so that you know we need to do some outreach to get them in for their Tdap or what have you. So this immunization box here in the medical care section will definitely be able to show you that. We have this little eye icon here to see more information. So we can see this individual specifically has just an anthrax immune globulin that was administered in September of last year. It's not known who administered it. The source was manually entered. Again, this training environment, so it was all fictitious. But if this had come from tennis, the source would actually indicate here that it had come from tennis. If it was something that was claim-based, so for example, if you provided a vaccine and submitted that claim, the source would indicate claim and that it had been administered by whomever at your practice had provided it. All right, we do also have medications, allergies, and diagnoses listed again here as well. All right, so the last section is the profile. And this can be helpful again. So when I had indicated that you can list an email out, but maybe we at TennCare do not have that to be able to populate it, you can come into the profile and add that contact information. So we have here a little space personal email. You can do this little edit pencil icon and add that personal email address here. And then go ahead and save it. So then it would come up and populate here. Let's just see. Great. All right, so we have it right here. And so it'll give you a bit more of their demographics. You know, we also have a few other tabs up here. Maybe emergency contacts is something that you'd like to have within the tool and be able to see. So we have all of those tabs up here. Many of these are not populated, so legal documents, you know, we don't have anything that's going to populate here. That would have to be manually put in. Again, this is not a source of truth, so any of those legal documents really need to be in your EMR system for sure. All right, questions on the health tracker, medical care, or profile section? All right. So the last thing I do want to go over is for those practice administrators, how to assign members to the care coordinator. So to do that, the practice administrator would come over here to this left-hand menu under care management and click on assign members. And it's going to auto-populate the entire member panel. There's specific ways that you can segment this out to make it a little bit easier depending on what your workflow is and how you assign out to care coordinators. You can do the search with the entire member panel. You can look up members attributed to a specific provider within your practice, if that's how you assign them out. You can, you know, do them by date of birth, the health plan, gender. There's various ways to do this that you can segment them out, and it really depends. I've heard so many different ways on how practices divvy out to care coordinators. So you have the ability to search for multiple ways. Let's say, for example, that you have already assigned a care coordinator to a set of members, but maybe they're going out on extended leave, or maybe they've left the practice and you need to reassign them. You can search by those members assigned to a specific care coordinator. And we'll do this little search. And so it's going to pull up all of Preeti's assigned members. To assign them to someone else, we would just click on all of the little check boxes next to the members you're wanting to assign to someone else. And scrolling through multiple pages, it will actually keep these saved. So maybe you know you want the first 2 pages assigned to someone else. So we're gonna have everyone checked on this first page, scroll to the second, and we're gonna select everyone on the second page as well by clicking those checkbox. And if we go back to the first page, we'll see that they're all still selected. So from here, we then click on the little assign members icon, which is the person with a little checkbox, and it's going to indicate that you have the option to assign them to 2 care coordinators. You know, depending on your practice, you may only want them assigned to 1, but you can assign to a secondary if you'd like. So from here, you'd have a drop down with the care coordinators assigned to your practice that have CCT access, and you'd be able to select them here. So for this, we're going to say these members that were assigned to Preeti are now going to be assigned to Patrick, and we'll check the box to assign. Oh, and of course, something's gone wrong since I'm trying to do this, so I apologize for that. But that is how you do it, and you would be saving it. So everyone assigned to Preeti would then now be assigned to Patrick. Similarly, if you were wanting to just originally assign somebody, you'd be able to go through your member panel, however you're going to divvy them out, and then check those specific members, then check the box, the little icon with the person and the checkbox, and assign out. So that's a great question, Allison. We currently don't have the ability to assign a care coordinator to a specific location or clinic. It's something that we're looking into for the future. So if you have a little bit more detail on how that works for your specific clinic, you can email us at tencare.cct@tn.gov. We'd love to hear that. Okay. Any questions on assigning care members to care coordinators? The last thing I promised was going over the learning and training page. And so this has all kinds of great information for you. And I'm going to go ahead and copy and paste this web address into the chat. So this has our YouTube channel, which has all of our previously recorded training sessions available to you. We have just an overview of showcasing what the CCT is used for. And then we have a lot of great quick reference guides for just common tasks you would be doing within the CCT that are great references. We have a frequently asked questions PDF that can be very helpful answering some of your questions as well. And then we have a CDPS plus RX risk adjustment presentation, which goes into the detail of how the CDPS plus RX identifies risk levels for individuals. So this is a good one to go to as well. And again, today's training and tomorrow's training are going to be up on our YouTube channel, the link right up here, by early next week. So you'll be able to come back to this and watch again, or if any of your colleagues weren't able to make it, they can come back and they can come to this and watch this. Right. Any questions before we wrap up for the day? All right, so thank you for joining us. I know this is a lot of information. Tomorrow we're going to be going over more information. We'll be going over the admission discharge section, quality measures and gaps in care. And we will have some open office hours, so maybe you don't have your questions yet. Come to the open office hours. Those are optional, but you can drop in with your question, get it answered, and leave. Those will be March 29th and April 9th from 12 to 1 p.m. Central. So thank you so much for joining us today, and we hope to see you again tomorrow. Thanks, everyone.